folks, we're going to really quickly go through our OBS kit, and this is going to help us set up for if we have to deliver a baby. So I just want to reiterate, this doesn't come out when we find out if mom's pregnant or mom is in labor and we just get on scene. This comes out when we think we're going to have an emergency delivery. So the goal of when we're treating a pregnant patient, certainly one in labor, is not to deliver on scene if we can help it. So rapid transport, good assessments while we drive, and get them to the obstetrician. But if we have to deliver on scene, this is what we're going to break out. So as soon as you think that there's a chance you might have a delivery, you might be delivering on scene, we're going to break out our OBS kit. You can find your OBS kit. Typically, it's going to be in your pediatric bag. So on an EMS, it's the orange bag. There's other equipment in the bag that I'll pull out, but oftentimes you'll see companies will buy or purchase commercial obstetrics kits. So they all come pre-packaged. So inside you're going to see a drape. So this is going to go underneath mom. It's going to kind of cover your whole workspace around mom. This is to cut down on any mess from the fluids and just keep everything a little more sterile. We've got some more sterile wipes that we can use to lay mom on, or lay baby on when baby's born, as well as cover mom. So if there's some feces hose out or urine or any extra fluid or blood, we can use this to mop these up. Should have a whole bunch of these. So it's nice to have these all set out and ready to go. I'll lay these over here. We'll say that mom's here. We've got some more maternity pads. This is going to help with fluid and bleeding. Have these ready. We've got our sterile scissors, so you can open these up and have them ready. We're going to use these to cut the cord, so have that laid handy. We've got our bulb suction. Bulb suction is used to suction air fluids out of a baby's mouth, or a newborn's mouth, excuse me, and nose. We've got, this kit has a whole bunch of scissors. Typically you'll only find one. Got a set of sterile gloves. Whenever possible, try and put on sterile gloves when delivering a baby. Try and keep this whole procedure and process as clean as we can. So when possible, put on your sterile gloves. We've got our clamps. Typically you'll find these kits will have two sets of clamps, one for closest to mom, one for closest to babe. Make sure they're laid next to your scissors. So in this case, I'm not opening anything, I'm just laying it out. If we thought that there was a delivery imminent, we would open all these up and have everything ready. If you're just kind of concerned, maybe we're going to deliver in the truck, you might have this stuff laid out ready to go. Alcohol swabs and betadine swabs, just keeping everything clean again. A few more of these sterile pads, a bunch of gauze just in case we need it. We've got a garbage bag here. That's going to be for the placenta. So remember, when the placenta is born, you're going to take this, you're going to take the placenta and put it in this bag and take it to the hospital so the OBS folks can see it. Here's our other clamp. Another set of sterile gloves for your partner. And now we're getting into some specific things for the baby. We've got a hat for the baby. Typically newborns will lose most of their heat through their head, so it's important to keep that covered. We've got a nice warm blanket here. I say warm. If it's not warmed previously, you can get hot packs and wrap around it. Pro tip I like to use is to get bystanders to throw towels in the dryer to get them heated up. So if we think about all the equipment we've had, some of this will be laid by mom as we deliver the baby, and then you should probably have a station separately set aside for where the newborn's going to go, just in case the newborn gets sick. So blankets that are warmed, that hat, the bulb suction should probably all be over in our newborn working area. Other than that, we've got some airway equipment here for the newborns. At the PCP level, we won't be fooling too much with the airway, but ACPs can intubate, they can put it in an iGel or a KLT. What we will be using will be our BVM. This is a big one, but you can get smaller BVMs that are more appropriate for the newborn. So have all of those things laid next to the newborn. Other than that, you see one blanket. We're going to have 3 or 4 more blankets laid out ready to go. Baby's going to be wet. We have to preserve heat, so we'll swap these out as soon as they get wet to try and keep the baby nice and warm. Hope that helps.